natural preventive and therapeutic approaches to inflammatory diseases. The foods that we eat can lead to, or prevent, inflammation, which is a major cause for many of the common diseases. Inflammation is a crucial protective reaction. It is there to protect us so that healing can take place. In this lecture, you will learn about some main causes of chronic inflammation. More importantly, you will learn how you may prevent inflammation from occurring by understanding the underlying causes. Inflammation is our body's normal response to an injury, an infection, stress, foreign substances, and anything that might be irritating us. In medicine, we use the suffix itis to mean inflammation. For example, pharyngitis is an inflammation of the throat, or sore throat. The classic signs of inflammation are swelling, redness, pain, and warmth. The body turns on its defense mechanism to defend against a toxin or foreign invader. Cancer, Alzheimer's disease, and cardiovascular diseases involve inflammation as a major part of their developmental and manifestation processes. Polluted air, chemical irritants, second-hand smoke, and pesticides are all seen by the body as foreign invaders. They turn on our immune system. They are foreign particles that the body is responding to. This irritation can lead to chronic inflammation of the lung and can even increase the risk of cancer. Ulcers can be a result of chronic infections that are caused primarily by a bacterium called Helicobacter pylori. This bacterium sits in the stomach, triggering reactive inflammation in the stomach tissue, which ultimately can lead to the development of ulcer, and sometimes can even cause stomach cancer. A sensitivity or allergy to a food causes an inflammatory response. An allergy is a quick reaction, and the immune response is that we produce a protein called IgA. A food sensitivity has a more gradual course that leads to chronic low-grade inflammation, and it involves an immune factor called IgG. Another common cause of inflammation is obesity, and particularly midline weight, which involves building up your weight around the midline of your body. Those fat cells are in fact an inflammatory organ, and they produce cytokines, which raise blood pressure, cause inflammation, and increase the risk of developing diabetes. If you have chronic sleep disturbance or even just a few hours of lost sleep, the body turns on its defense system, which leads to inflammation. It may be correct to say that sleep deprivation is the major cause behind almost any inflammatory reaction in the body. Sleep apnea, for example, affects those who snore and then stop breathing. This can also lead to chronic inflammation and weight gain. What you eat can turn inflammation on, but more importantly, what you eat can turn inflammation off, or at least limit its scale. The number one cause of inflammation is refined sugar, which exists in the form of corn syrup, dextrose, fructose, golden syrup, maltose, and sucrose. If you have any signs of inflammation or any problems linked to inflammation, such as heart disease, memory loss, and arthritis, it may be prudent to try to eliminate refined sugar from your diet completely. Trans fats are a modified form of fat that increase and oxidize the bad cholesterol, or LDL, which leads to the laying down of plaque in the vessel. They also lower the good cholesterol, or HDL. Trans fats are found in deep-fried foods, fast foods, and commercially prepared baked goods, and they usually appear on labels as partially hydrogenated oil. Cow's milk also leads to inflammation. People who are mildly lactose intolerant typically develop stomach distress, diarrhea, gas, and bloating. Cow's milk consumption could be also one of the causative agents of certain types of arthritis and skin rashes. Cured meats and particularly processed red meats contain a substance called Nu-5-GCT protein, which is a compound that the body sees as a foreign invader, so it produces antibodies and triggers an inflammatory response. Excess alcohol consumption is rampant nowadays in many cultures and is linked to irritation and inflammation of the several parts of the digestive system. Esophageal and laryngeal cancers are linked to alcohol consumption. High consumption of alcohol affects the liver as well and could lead to cirrhosis or alcohol-induced hepatitis. Over time, Chronic inflammation from alcohol can lead in the liver to hepatocellular carcinoma, which is a liver cancer. Artificial food additives, artificial sweeteners, and preservatives, such as monosodium glutamate, sodium nitrate, sodium saccharin and aspartame trigger the inflammatory response. It is advisable that you do not buy anything in a package unless you can read the label and identify the rather unsafe ingredients. To prevent inflammation, it may be prudent to try to always eat whole foods, wholemeal bread, fish, and whole fruits and vegetables. Use olive oil if possible, instead of oil made from corn. Drink filtered water, but do not drink water from plastic bottles because it is neither good for the environment, nor for your health, as a huge amount of plastic nanoparticles will dissolve from the plastic bottle material, and move into your bloodstream, then to your organs when you drink from a plastic bottle. These plastic nanoparticles are major culprits in development of many diseases, including several types of cancer, coronary artery disease and Alzheimer's disease/dementia. Tea is the second most consumed beverage in the world next to water. Research on black tea shows that black tea dilates blood vessels, which is a good thing. Like broccoli, turmeric, and shiitake mushrooms, green tea can protect against cancer. It is anti-inflammatory and can reduce cardiovascular disease. Herbs and spices, when used correctly, have powerful anti-inflammatory components. Tulsi, also called holy basil, is a herb that comes from the Indian subcontinent and is pure anti-inflammatory. Research studies have shown that turmeric could be as good as hydrocortisone for treating inflammation. Turmeric also has anti-cancer properties. Ginger is a spice that has powerful anti-inflammatory benefits. It also has the added benefit of helping with nausea, not only related to cancer and chemotherapy, but also related to pregnancy. Basil, which is a staple in the Mediterranean diet, is anti-inflammatory, as is rosemary. Copyright Academy House www.academy.house